90% of all symptoms that we experience and report to our primary care healthcare professionals about are secondary to chronic stress. And instead of just giving a pill for an ill, if someone's back is hurting, they're not sleeping, they're not digesting their food, and so on. I mean, all of these things, they're pre-diabetic and they're hypertensive and all these things, instead of just managing their symptoms, illnesses, and diseases, which is what we're taught as Western trained physicians, the question that isn't asked is, what's going on in your life? What's happening? Really getting to the root cause of what these symptoms are manifesting from. Now, sometimes we do need medication and sometimes we do need procedures and therapy and so on, but the research is telling us that up to 90% of those symptoms are actually related to stress. And so that's an amazing thing because then we can work to help to relieve them.
Hey friends, Dr. Rock here, and welcome back to the Health Feast, where we talk about good health, not just as a punishment or a chore or something to check off, but something that can actually feel good, like really good, like something joyful, communal, and abundant, even indulgent, just like a feast. So before we dive into today's episode, I just want to say thank you. I asked you, my audience, to recently consider leaving a review on Apple Podcasts, and lo and behold, one of you did. And here's what you wrote. As someone who is interested in lifestyle medicine and as a practicing physician, I listen to this podcast regularly as a source of both inspiration and education. Dr. Rock does an excellent job of engaging with his guests. I highly suggest you check it out. So, thank you for that review, Dr. Cards T. And seriously, reviews like this help more people find the show, and they just brighten my day. And I would love to read your review on the air. I read every single one of them. So if this podcast has inspired you or taught you something or made you feel a little more connected to your health journey, I'd be so grateful if you took a minute to leave a quick review. Okay, on to today's show. Today's guest is someone I've really been looking forward to sharing with you. This is Dr. Robyn Tiger. Dr. Tiger is a double board certified physician, certified yoga therapist, life coach, and the founder of StressFreeMD. She's someone I met through, guess not surprising, the American College of Lifestyle Medicine. And if you've ever been to an annual lifestyle medicine conference, you may have seen her leading early morning breathwork or yoga or mindfulness sessions. She's also a good friend of our past recent guest, Dr. Melissa Sunderman, a friend of the pod. Robyn brings this peaceful, grounded presence wherever she goes. But her story didn't start there. Years ago, she was practicing as a radiologist, and her body was falling apart. She suffered from migraines, numbness, insomnia, digestive issues, anxiety. She saw all these different specialists, ran all sorts of tests, took all sorts of meds. Nothing really helped. And then she came to the realization that the diagnosis was chronic stress. And what followed was a deep personal transformation. Now she helps other doctors and everyday folks heal through chronic stress through tools that are simple, effective, and surprisingly doable. Well, in today's episode, we explore why so many of us numb with food, alcohol, overwork, or scrolling, and how to stop the buffering of emotions. We also talk about the moment that one yoga class cracked her open and changed her life. We talk about what physician burnout is and isn't. It's not a personal failing, but rather a cultural and systemic issue. And we discuss her favorite go-to tools that help people feel better right now. She even walks through one of these tools during the episode. It's simple, science-backed, and honestly, it works. Robyn's story is powerful. It's personal, and it's one that I think will resonate with anyone who's ever felt overwhelmed, stuck, or secretly falling apart. So, whether you're on a walk, decompressing after work, or lying in bed wondering how to slow it all down. This episode is the perfect companion. Let's find out what happens when a doctor finally learns to heal herself. So let's do the show.
Right?
Robyn Tiger, MD.
Yeah.
Welcome to the Health Feast. It's really nice to have you here.
I'm so happy to be here. I feel like I just saw you at the conference.
Yeah.
And we got another one coming up.
And yeah, those are like Lori Marbus was my, do you know Lori Marbus?
Yeah. I know who she is. Yeah.
Okay, she was my former boss when I worked at the startup, Mora. And she says like, it's like you're like getting recharged. It's like the Energizer Bunny. So you go to one of those conferences and then your battery gets recharged so that you can keep going and going until the next conference.
That's such a great analogy. It feels amazing being there, and then you feel so good when you go home. So I love that.
Yeah. So I'm still a little charged from November. It was really cool to meet you there. I think we had interacted with each other. I hadn't met each other, but I think I'm excited because you epitomize your story. I think epitomizes the epidemic of, I don't even like the word burnout, so I want to talk about that with you too, but the epidemic of what we call burnout, physician burnout, and how there's a way through, and now how you're kind of helping and inspiring people to find that way for themselves, which I think is really awesome. So I'm really excited to have this conversation today.
Oh, thanks. Me too. It's definitely coming straight from my heart, this whole conversation. And I agree with you. Semantics is everything, and we don't necessarily need to label it. It might look different to different people, but ultimately how we take care of it is the same.
So thank you, by the way. You sent me your book, Feeling Stressed is Optional, which so easy to pick up and read like different sections of it, because there's tools, there's different practical things and different things that sure speak to me. But I think giving people like some language around these things, but then also the liberty to understand that your situation is, I think that's what you're saying, like your situation is uniquely yours. And this is what the experience can feel like, more important than what we call it.
Yeah, exactly.
Yeah.
Exactly.
So,
and that gives you ownership of what's going on in your own life as well, and agency.
You yourself, you describe it in such a prolific way. I think you said something like, I don't know, I don't have it open, but you said like every day you were saying to yourself, I hate this. Like, I don't like this life. And in no uncertain terms, that's how you were sort of operating. And then you describe like a lot of stress and things that were probably, I don't know, would you say contributing, or was it a matter of like those circumstances at that moment? Like you had a baby and a toddler. You said you were commuting 3 to 4 hours a day. That really stuck out to me. I was like, wow, that's a lot of audiobooks.
Yeah.
But take us back to that time, because then your proclamation was like, every day I would wake up and sort of be like, I really hate this.
Yeah. So like most doctors, we went into this field to serve, and our heart is wide open. And you might be able to remember what it was like when you got that acceptance to medical school, why you even filled out that application to begin with, what it was like to put the coat on for the first time, that I ended up ditching after a while. But we remember that feeling and remember our why. And that's the thing that gets squashed out and we lose when we get into situations in our life that don't serve us in the way that we anticipated. And so what happened to me is, yes, I was married, still am, to a great guy who's also a physician. We had 2 young kids, had a dog and a house and a car, and was really involved in the community as well as my kids' schools, as well as the hospital and the organizations. And I started to develop a lot of symptoms that seemed really disconnected. And they didn't just happen over one day. Really, it took months, years, really over time. beginning, if I'm honest, probably back in residency when I started with these migraine headaches, which I'd never had before, with vomiting, really debilitating, having to leave the reading room, which is already dark, to find someplace even darker, just to, try and dissipate this light sensitivity and the sound sensitivity and the banging in my head. And I just had all these other symptoms as well, where I developed really bad reflux with burning chest pain and tinnitus. I had ringing in my ears so loud I couldn't sleep at night. Vertigo, where I would just turn my head and the whole room would start spinning. My gums would spontaneously bleed, which really seemed disconnected from everything else. My body hurt. I said I felt like the Tin Man. I call it like Tin Man-itis, where I just couldn't move. Like everything just hurt so much. I couldn't digest my food, Rocca. Was like everything I ate, my abdomen distended. I got pain. I had diarrhea, constipation. I didn't know what I was going to get on any given day. I couldn't sleep. I was exhausted, anxious all the time.
Like you said, this didn't crop up all at once.
Like
this was like a
over
progressive
time.
over time, like a
Yeah,
layering
over
on
time.
of more chronic symptoms.
Yeah, over time.
What was your awareness of them at the time? Like, were you thinking like, oh, here's another issue? Like, did you have any sense that they may be connected in some way?
Not at all. For the gum issue, I went to a periodontist it was injecting all kinds of antibiotics in my gums, saying you're inflamed. For the GI issues, I was given all types of anti-reflux medications. And for the sleep, I was given sleeping, aid medications. For the pain in my body, I was given other types of medications. And I was sent to PT and OT and told to go get massages and acupuncture. For the tinnitus, for the vertigo, and for the symptom of paresthesias, which I didn't describe yet, where I would get these numbness and tingling in my hands, my feet, and the left side of my back, where, of course, as a left brain physician, I was terrified I had a debilitating neurologic disease like MS or something.
Yeah, right.
I went to a neurologist for all those things and the migraines, and I got medications for that and all kinds of imaging, and where this is going, pill for an ill. And so I had a whole pile of pills and I wasn't getting better.
You were feeling worse, probably.
I was feeling worse from all these pills, and I wasn't getting better. And I was trying to make all these appointments and all these therapy appointments. And then I started having some bad thoughts, like, again, you mentioned, like, I just don't want to do this anymore. Like, I just don't want to be here, which was terrifying. Terrifying to have those thoughts, especially having 3 physician friends / colleagues die from suicide. And so that was really over several years of building. And when it happens in that way, you can't really see it. You're like, oh, now I'm having abdominal pain. Oh, now this hurts. Oh, now, I can't, I'm having digestive issues, blah, blah, blah. And labs are normal. Imaging's normal. Scopes are normal. Nothing's coming up as anything. And you're just this mess. And you're like, what's going on?
Yeah. Was there a breaking point?
I think when the thoughts started, really, we can push through anything. Physical symptoms, we pretty much are just like, whatever, as much as they're uncomfortable and horrible, we just push through them. But when I started to have some dark thoughts, and having lost those 3 colleagues, I just said, whoa, all right. Western medicine is amazing. We're Western medicine trained physicians, but there has to be something else. There needs to be more. And I was already running races. I was working out too much, actually. I was taking it to an extreme to not feel anything, looking for escapes. I was eating what I thought was a pretty healthy diet at the time, which I learned had lots of tweaking to do. And I didn't know what else was going on. What else could I do? Western medicine was failing me, essentially. And it was really the thoughts that were so terrifying that really caused me to pivot.
The thoughts about me, our potentially harming yourself.
Yes, I don't even had any plan to harm myself, but I just thought that I'm in so much pain emotionally, psychologically, physically, that it would be easier to just not be here. So it was just that thought.
I had those same thoughts. Can I share that with you? I don't think I've
Yeah,
really
please.
shared that with anyone. I was working in the hospital and I was like burnt out and whatever you want to call it. I think so many things you said, like on paper, you look at your life on paper and you had this great job. Your husband's a doctor. You have 2 beautiful kids. You're on these boards. You're involved with the schools. Like, wow. Like, and I look back sometimes to my life and I'm like, I was so unhappy. And then at some point I asked myself, like, why are you so unhappy? When, like, from a bird's eye view, this is what you always wanted. And did that thought come into your mind ever?
Yeah, and with that thought, Rock, comes all of the guilt and the shame of who am I to complain about anything? Because I have everything. So from the outside, I looked perfect, right? From the outside,
So it's like,
it looks
I'm not
perfect.
even allowed to feel this way because you have everything. Yeah, that's right. I remember feeling that same way. Like, but then, if you're depressed, I have a history of depression and you have, negative thoughts that you don't see outside of that. You don't see outside of that at the time. You can't see outside of that at the time.
Yeah.
How did you see outside of that?
Well, when I started to have these dark thoughts, and that was really what scared me, and looking into my children's eyes, really, and not wanting that for them, needing to be here for them. And like I said, I was already working out.
Your daughter said something, right? Your daughter said something to you. What did she say? I really appreciate it when you look at me when I talk to you.
Yeah. So yes. And so she said this to me after I started to figure out what was going on and I was feeling better. And so, which we can come back to how that happened. But yeah, she said to me, and she used to bookend sentences with mommy. So she would say, "Mommy, I really like it when you look at me in the eyes when you talk to me, Mommy." And I was like, oh. From the mouths of babes.
Oh. I mean, were you feeling like in that was like, oh, I'm not doing that enough. Like, I'm not even consciously doing that.
Yes. So I realized that I was present with her in that moment. And I realized that the tools I started to apply were effective, bringing me to that place of presence. And then I realized how I hadn't been present, that a few-year-old daughter at the time would recognize that I hadn't been looking at her when she was talking to me. Yeah.
So we skipped ahead a little. Like, tell us about your journey of kind of healing.
Yeah. So, going back to all of those symptoms, physical, emotional, psychological, not knowing, what to do, taking all the pills, doing all the treatments, the therapies, and not getting better. I started seeing advertisements for this like Yoga 101 series at a studio near my home, which I did a lot of eye rolling. Right. And, because I'm a gym rat and I run races, and that's for those really weird people, doing weird things down the hall and the door closed and who knows what the heck's going on in there. And some people listening might have those same thoughts. And I have to say that my egotistical left doctor brain decided to give this a try when I saw that the individual teaching these classes was a professor at the local university in anthropology, and she actually owned the studio. And so credibility factor went way up when I thought that, well, she's got to be authentic. She can't be some Molly Moonbeam weirdo person. Like, she needs to be someone that's probably intelligent. And so I signed up for this class. I didn't want to go alone. My next door neighbor's a nurse. I asked her if she would go with me. She also eye rolled at me. And I said, hey, like, if it's really bad, we'll just go out to dinner. We'll just, just get out of the house. And so she said, okay. And so I can remember that day, Rock, like it was yesterday. I remember, I can't tell you how many cases I read, how many biopsies I did, how many procedures I did. I got home exhausted. I fed my kids, I bathed my kids, I handed them to my husband, and with one eye barely open, I got to this 7:30 at night class. And the whole time I'm driving there, like, why am I doing this? Like, I should be, folding the laundry, emptying the dishwasher, prepping for my patients for the next day. I mean, you name it. I was like, anything but this. And I thought it was going to be a waste of time. And at the end of the first class, my whole world shifted. I felt calm. My body didn't hurt. I was focused. I wasn't tired. And I didn't know what happened. I was like, what happened? Is this my dreaming? And so that was the beginning of my diving into.
I mean, it must have been a really good instructor. Nowadays I do yoga actually twice a week. In fact, I just had the person I kind of program I follow, I just had him on recently. And have you heard of this Man Flow Yoga?
No.
Okay. It's a men's yoga program.
Sounds like it.
I'm curious, we could talk about it later or now. Like, like the idea is that like men's bodies are actually, every time I went to a yoga class, I didn't have that experience that you had. I always felt like I was doing something wrong. It felt uncomfortable to me. And I was, I don't know. I didn't have that experience, I have to be honest. And then more recently, I've done stuff on my own, and then I found this men's program. So I love it. It's like a regular part of my life now. But you had this instantaneous connection with it. So I just want to know more about that, because not everyone does. Or maybe, what's your thought on that? Like, why you had such a profound experience the first time?
Yeah. So like anything, it all depends on your teacher and what you're being taught. And I've taken a lot of classes that I haven't liked. And that's both in yoga, that's both in meditation, that's in fitness, that's in academics. I think that it really depends on who's sharing the information and how they're sharing it. And I've really taken that education right there with me in the last decade plus of my life when I educate others. And so the thing is, it wasn't about twisting your body into some crazy shape and being uncomfortable and spandex and weird music and all the other things that people might be thinking about. We had a lot of conversation back and forth. Questions were being asked in this class. There was a lot of focus on breath and how breathing works and why. There was focus on meditation. Yes, we did movement, but it was very comfortable. There wasn't anything uncomfortable. There were lots of pillows and cushions and things. You could be in a chair, you could be on the floor. I mean, it was so welcoming and inviting, and everything was by choice. And just the whole really laid back experience mixed with some intellectual stimulation by the questions and the answers really led to a wonderfully transformative experience. And so I think that any subject can be amazing or not, depending on who's teaching it and how they're teaching it.
And I imagine you experienced this downshift, right, in your nervous system during that class that you weren't routinely experiencing based on the life you were describing. Like, you had a very ramped up sympathetic drive probably most of the time.
Yeah, which is exactly what I came to understand, because I didn't understand that before. And so I remember driving home from that first class and many classes after that, and just diving into my books, because we didn't have computers then. That's how long ago it was. We actually had real books that we hold in our hands and we read, and medical literature and research. And I really came to understand just what you said, that what I was experiencing and many of my symptoms, eventually all of them that I described to you, went away, even the dark thoughts. And so over time, and so what I was suffering from was the diagnosis that nobody was making, which was a whopping case of chronic stress. And that stress, that imbalance in the sympathetic nervous system, that sympathetic drive, was causing lots of stress hormones and inflammation, cortisol, cytokines, so on, wreaking havoc on my body and showing up in many different ways. And so once I really came to understand that, because our left brains like to know the why behind things, right?
Yeah.
It really made a lot of sense to me. And then I was able to dive in deeper and study more.
Well, let me ask you then, like, how much of healthcare is this? Like, how much of what we take care of? I mean, the symptoms you describe are like, I don't know, like so many of the complaints that, or issues that patients bring regularly to their doctors.
Yeah, that's so wise what you just said, because up to 90% of all symptoms that we experience and report to our primary care healthcare professionals about are secondary to chronic stress. And instead of just giving a pill for an ill, if someone's back is hurting, they're not sleeping, they're not digesting their food, and so on. I mean, all of these things, or they're pre-diabetic and they're hypertensive and all these things, instead of just managing their symptoms, illnesses, and diseases, which is what we're taught as Western trained physicians, the question that isn't asked is, what's going on in your life? What's happening?
Yeah.
Really getting to the root cause of what these symptoms are manifesting from. Now, sometimes we do need medication, and sometimes we do need procedures and therapy and so on, but the research is telling us that up to 90% of those symptoms are actually related to stress. And so that's an amazing thing, because then we can work to help to relieve them.
Yeah, right now, our healthcare system, generally speaking, like, stress is not addressed. Like, it's not, if it's talked about, maybe, but I don't know, it might be as addressed as much. Like, I used to work in an HMO at Kaiser, and I feel like they do a better job. But even there, it was like, oh, we have this health education class on stress that you can sign up for if you want. That's sort of the offering, which is probably better than a lot of other places. I mean, a doctor might recommend, they might say, oh, we have this class on stress. You should. So some people are getting that, but what you're saying, it almost makes more sense that it should be like, well, it should be foundational. This should be taught in school.
Yeah. And the people that are intuitive enough to realize they want to take those stress management classes are wonderful. But here I am, a Western medicine trained physician with all these symptoms, and had no idea that's what it was from. So if I don't know that's what it's from, think of how many millions of people out there are suffering from symptoms, and they don't know that they actually can relieve those symptoms.
You're right. I think actually those stress management classes come up when, like, somebody, usually maybe the patient, has already labeled it as like, oh, I'm having issues with stress. But most of the time, these conditions are just labeled as the condition. Oh, you're having reflux because you're eating the, spicy food, and you need a PPI. Like, that's the conversation. Like, if you want to continue eating spicy food, then let's start the PPI.
Yeah. I mean,
Sorry.
I mean, it's hard not to laugh when you think, I talk a lot about KISS in my book, which is keep it simple. I'll say silly, not stupid. But the truth is, when we come back to what's simple, it really is simple.
Yeah.
So many of the time, we just weren't taught to think in that way and to inquire in that way about ourselves and about others.
Okay, so recognizing this and then going on this journey, at some point you decided, tell us about how you changed your professional practice.
Yeah, so I initially wanted to learn more about this thing called yoga, and I went into teacher training never thinking I was going to teach anybody anything. It was just me having a self-inquiry as to what is it that's making me feel better. And it was there that I learned about the field of yoga therapy.
Good.
So for people that are listening and don't know, yoga teacher training is a 200-hour base level of training. Yoga therapy is at least 1,000 hours over a 3-year period. And in yoga therapy, you can use the tools from yoga, and you're taught to help people with many different types of symptoms, illnesses, and diseases. And that really excited me because I thought, well, if I can feel better, how many other people can I help in this way? And particularly as a radiologist, I was diagnosing a lot of disease, and I felt like I wanted to be more impactful and more helpful. Like, for example, diagnosing someone with cancer, like they would bring me all types of gifts. And I would think, I wish I had a gift for you, knowing that you are going to be going through this unbelievable debilitation of physical, emotional, psychological changes. And, who's there for you? For example. And so I got really excited when I learned about that. And that's why I decided to go on to become certified as a yoga therapist. And it was there that I learned about meditation. And again, I used to do a lot of eye rolling because there are many flavors of meditation, and many of them are not for most people. And so finding a guided type of meditation that was originally created for our military at Walter Reed, that actually really helped me. And so I became certified in meditation. So now I'm working with the body, I'm working with the mind. That was another 3 years. And then thoughts, right? So we talked about some thoughts earlier. What do you do with the thoughts? And how do thoughts play into our health and our physical being? And they actually play pretty strongly, not only into what's going on with us physically, but also the results that we create in our life. And I really started to dive into cognitive behavioral therapy, which was the root of life coaching, which is what I was so helped from. And I became certified as a life coach. And so I was really just like,
wow,
layering on tools that were helping me and becoming certified in them along the way so that I can help other people. And then lifestyle medicine was in the middle of all of that. I met some lifestyle medicine certified physicians when I moved to North Carolina and Asheville, and I didn't even know what that was. And when they explained it to me, and I went on the website for American College of Lifestyle Medicine, my mind was like blown that there was this governing body of all these things that I was all about.
Yeah.
And then this one physician actually said they need to know about you, connect me with ACLM, the education department, and they asked me to join faculty to help with the stress pillar, which at that time was one of the weaker pillars, and to help write the board review manual. And so that's really been my journey is really, as I say, make your mess your message. What happened to me? How did I feel better? How did I keep feeling better? How can I learn how to help others feel better with what was helping me? And I just, continued that along the journey. And I decided, over a decade ago that that's where I wanted to put my focus. And at the time, I didn't really have an exact vision as to what that was going to look like, but I said, there are plenty of radiologists out here. Yes, I thought I was pretty good radiologist, but there are other people who can do this job. And there's a big hole that I want to fill.
Yeah. Like now, do you get do you get migraines now?
I haven't had a migraine in over a decade.
Wow.
I haven't had any of this. All those symptoms, the paresthesia, like all these things. I mean, I'd be doing a breast biopsy and I couldn't even feel the biopsy gun.
Yeah.
Cutting up vegetables, I couldn't feel the knife. Driving my car, I couldn't feel the steering wheel. I mean, these were terrifying symptoms. Now, interestingly enough, Rock, I have had several physician clients in the last decade who have paresthesias and who went to neurologists and had MRIs. And once they started learning how to regulate their nervous system, guess what? They started to feel better. They just went away.
Wow.
So it's not a common, the most common of all symptoms, but it's out there. And it's really interesting. The more people you talk to,
I have a friend who's a physician who has this, and I'm going to connect you, I think.
So I'd be happy to talk to your friend.
Yeah.
It shows up in different ways. Like I had one of my yoga therapy mentors who is also an orthopedic nurse. And she said that her mother-in-law lives in her left big toe. that whenever she was around her mother-in-law, she got all this pain in her left big toe. And that's like where her stress would sit. And so, it can sit in different ways in different people's bodies and show up in different ways.
I used to work in the hospital. I worked in a hospital for 12 years as a hospitalist, and I didn't even see this pattern, but sometimes it would be like a stretch of days, and then you'd have some stretch of days off, and sometimes it was, and so my wife noticed, but I would get just a horrendous back pain, like upper back pain. It was so bad, like I couldn't find any position that was comfortable. I used to have my kids stand on my back, and I was taking ibuprofen, and it wasn't really helping that much. Like I would take it, and I bought all these massage things, like guns and bands, and I don't know, all this stuff, and like things you roll on, and none of it helped. And but then one night I went on Amazon, and was searching for back pain, and like the second book that comes up is Healing Back Pain by John Sarno. Are you familiar with John Sarno?
That one, no.
Oh, okay. So John Sarno was this PM&R doctor, physiatrist in New York. He was actually, I think, at Columbia, but that basically treated people with mind-body medicine his whole career. And he told people, but he called it something. He said, basically, you have repressed emotions and they're manifesting as symptoms. And mostly he would treat people with chronic pain. And so I read that book. In the book, he says, like, half the people I treat who just learn this, they don't even have to acknowledge the repressed emotions. They just learn that the mind is doing this trick. And then the pain gets better. And that actually, for me, is what happened. It took me longer to figure out what were the emotions I was repressing. But just within a few days of like saying, because he has you do this self-talk, like, mind, I know what you're doing. You can't fool me. Like, it's a distraction, basically. That's what he says. The mind has created this distraction because it doesn't want you to think about rage or anger or sadness. Like, it's protecting you. And so in its protection, it's created this, it can do anything. And he said, the way he called it, tension myoneural syndrome. It restricts blood flow to the affected area, just so slightly. So there's pain, but not permanent damage. And he said, when they've done biopsies of people with fibromyalgia, that's exactly what they see, is reduced blood flow to various areas of the body. That is not ischemic, but so anyway, that's fascinating.
It's very fascinating, and it makes a lot of sense. So the type of meditation called iRest, little I, big R, like the iPhone, that I mentioned, that was created for Walter Reed Army Hospital for our military, that I became certified in, was created initially to help relieve symptoms of post-traumatic stress disorder, PTSD, or we like to think of it as post-traumatic growth now.
Yeah.
And my teacher was a psychologist and a yoga scholar, and was asked to come in to create something to help. But they said, you can't call it anything, again, semantics, like yoga, meditation, whatever. Like no one's going to do it. So the iPhone was coming out at the same time. And so they called it iRest, because who doesn't want to rest, right? And
no, this is the app, right, on the iPhone? Does the VA have an app? Or maybe I'm thinking of something else.
I don't know if it has an app for this. This was created several decades ago.
Oh, okay.
I'm not sure if there's an app or not, maybe. But it took a traditional type of meditation, which was guided, called Yoga Nidra, which is like thousands of years old. And it removed everything that could be activating. And it added in some psychotherapy, and it became a very systematic, like stepwise guided meditation that helped not only identify what's going on, an emotion, a feeling, a thought, a sensation, but to help process those emotions, feelings, thoughts, sensations. And what they found was that there was such a high incidence of decrease in chronic pain. And that's because most of the pain we're feeling in our body, if it's not related to some sort of trauma or illness, is from stress. And it has been so successful that the Department of Defense has declared this type of meditation a tier 1 treatment for chronic pain. So this meditation is being used across the board in the VAs, the military, active duty, veterans, and so on. And I just use it across the board with everyone that I work with because it's so effective. But that is going along with what you're saying, in that stress can cause lots of pain in our body. And that's because it's causing constriction of our muscles. We're going to run away from that wild animal, right? We have to hurry up and tense up our muscles. But this is happening all the time, even when there isn't a real emergency. And then we get stuck like that. And it causes a lot of pain, discomfort, like your back pain and so on.
Iris sounds really amazing. Like, is that still, how would one learn about iRest now? Like, if they wanted to learn that meditation or have it guided, is there like some online resource or?
Yes, well, I have one. Of course. Yes, because I got asked this question so much. And so, I mean, you can go to the iRest website and learn about it. I am certified as an iRest teacher. Like I said, it was a 3-year certification, and I have developed several online digital programs on demand where people can learn this meditation. And
cool.
Created all of these audio files, got little lectures and then audio files so that you can learn this meditation. And then it's not only passive where you are listening, you've got me or someone else in your ears, but it's active in that once you learn some of the concepts, you can learn to apply them during the day. So if an emotion comes up, what do you do? If a thought comes up, what you do? It's lots of really active tools you can use as well. So it's trauma-informed, secular, evidence-based, and really powerful.
Wow. That sounds awesome. Thank you. I'm going to check that out. I mean, it sounds like something I would benefit from, but just that, like just a powerful tool to use with patients. How many of the things that we're taking care of are just manifestations, overtly or directly or indirectly from this? 90%. I mean, in some contribution, that's it. And we spent $4.5 trillion on healthcare last year. Yeah, there's definitely, I mean, I ask you that, like, well, first, we kind of touched on it, but like the state of affairs with physicians right now and like our industry and the workforce, I had to leave that system. I think it was, I mean, I was still in the healthcare system. I still take care of people, but like now in a different way and through different mechanisms. But being in it was just, I don't know. So like, this is what I want to ask you, because is the solution, I think the solution is not like, you and I had to find a different way, because it was kind of like, whoa, this is not in alignment with, I heard you say at the beginning of like, why I even went into this. Like, you know, you went into this to heal, but like, I think that's most doctors. Like, most doctors went in. And so most doctors, they're experiencing, they're in a system that is so disjoint from their values.
Yeah.
Where do we go from here?
Yeah. So I see the problem as twofold, Rock. I see that we have this broken healthcare system. You know, when I was growing up, there was this Norman Rockwell painting. I'm not sure if you're familiar with Norman Rockwell, but even if you're not, you can imagine this painting. So there's this little girl and she's holding up a doll. And then there's this older man, doctor, who has his stethoscope and he's listening to the doll's heart as she holds up this doll. So picture that. That was my, you know, that's what I thought medicine was, right? So beautiful. Just how special is that interaction?
Like this,
right?
this healing force presence that you can be in someone's life.
Yeah. Being seen and heard and, you know, all that. I didn't end up going into that type of medicine, but that is old school medicine.
Right.
You know, that's the way it used to be, actually listening and having that sense of connection, which is really, really lost. And I think that is one of the biggest problems that we have right now on the way medicine is being practiced. But in this twofold problem, we have this broken healthcare system, which has many facets to it. And then we have the human. And I can't fix the healthcare system. I wish I could. People are working hard to fix it. Not sure if I'm going to see it fixed in my lifetime in the way that I think that it could best be functioning. But we can work at the level of the human. And that's where the magic is. And we are missing so much education, so much on how to take care of ourselves, how to feel better by ourselves, how to increase our own health span, how to increase our own joy, our own fulfillment. That's where we can do the work. And that is where I live. And that's the space that brings me joy and fulfillment, is working at the level of the human. So there are all these problems, and people say to me, the healthcare system is broken. And I'm like, you're right. And then they're shocked that I say that. I'm like, no, I agree with you. And what about you? And what about your health and well-being, fulfillment and joy? And how can we focus there, independent of that broken healthcare system, independent of what's going on in politics, independent of what might show up in your life, that phone call you might get, and so on. We can work at the level of the human.
Because everybody wants what you're saying, but they've constructed it's their thoughts. It's their thoughts that are preventing them from actualizing that. Or what is it?
Their thoughts, and it's really lack of education. It's not their fault. They were just never taught. They weren't taught.
None of us were.
All the things that we learned, they weren't taught. I work with a lot of medical students. We're still not teaching in a lot of the medical schools, right? And so there's a lot of people, once they do feel better, and they get upset with themselves. I should have known this already. I should have been doing this stuff already. There's all this shoulding, and I'm like, wipe the shit off, right? So, you don't know what you don't know. And once you do know, and once you do learn, that's really where all the transformations occur. And that's when you get in the driver's seat of your life. And that's when you're in charge again, right? Independent of this broken healthcare system and all the other things happening in the world. The only thing you can actually control and focus on is yourself. And you just need to learn how to do that.
So if you could change one thing about medical training, or like if you had a magic wand, a brush, like what would that look like?
I would love to have my own medical school.
Oh, cool.
I don't know how to do that, but all of this education about stress prevention and relief, of healthful nutrition, of moving your body, of connecting with others, of sleeping, escapes, even nature, right? All these things, all of these pieces will be intracurricular. So just like you have anatomy and physiology and pharmacology and microbiology and all these things, right? This education will be intracurricular. Not like, oh, we have some fitness classes available to you. There's a meditation room if you'd like to go up there and hang out. Like, I've been in those medical schools. Like, that again is not educating properly. They need to become lifestyle behaviors that, just like brushing your teeth, these are things that you're just doing all the time, becomes enmeshed in your life and becomes part of your life.
At my previous job at the hospital I worked at, we had a residency program, and I would give talks on lifestyle medicine. And we brought the lifestyle medicine residency curriculum when I was there. And what I loved about the curriculum was there's this like practical component where you have to do things for yourself. Like, some of the practical component is your self-care, which, is a requirement to get certified, is that you're taking care of yourself, which I think is really, like, when has a medical student or anyone been told, like, you can't get this certification until you are like taking some time to move your body in a way that feels good for you, or that's amazing. Yeah. But not everyone did that curriculum, right? To your point, it was like certain people wanted to and wanted to. So, okay, I'm down. I want to come to the Tiger Medical School.
I know. I would love, I've had these dreams of having a medical school where, this is all part of the education. So research shows that when they evaluate students that just graduated college, and they compare those who go into medical school and those who don't, the thinking would be that those who are going into medical school are already burned out and exhausted, depressed, anxious, stressed, and so on, because they've been working really, really hard to get into medical school. So they're coming in already broken, right? The research shows that actually that's not true. Actually, those students that are going into medical school have a higher level of emotional availability, of physical health, of psychological health, and so on. And it's actually the system, the way that we are educating in medical school, which then starts the process of this downward spiral of physical, emotional, psychological, poor health. And I was really blown away when I learned about that research, because in my mind also, I could imagine people thinking, oh, they're just already exhausted and burned out. I mean, now they're going into med school and they're coming in already, half a person. And the truth is that's not true at all. Actually, the research showed the opposite. Yeah. And so that tells us that our existing ways
it's creating
of
the problem.
It's creating the problem. And that problem only escalates when you see the research on interns and then residents and then into attendings. And so the research just continues and just proves over and over again that it's the system that's creating this. And the thing that's lacking is the education.
I do feel, now I'm not as involved in residency anymore. My wife is, she's an academic nephrologist, so she works with fellows and residents, and she does feel like that. She tells me that this younger generation is more aware of their self-care needs and the importance of it, that it comes up more ever than it never came up when I was in training. Like it sort of did, but not really. It was like, we have to make sure you actually stick to 80 hours because we might get audited, was like the self-care.
Oh my gosh.
Message.
Right?
I had a meeting that was like,
that's so bad.
Love that you're so dedicated, but like you're documenting more than 80 hours on your, and there's an issue with the so I'm like, is there an issue with the documentation, or is there an issue with the amount we're being expected to do? So now it's a little different, I think. I mean, I think residents still work a lot, but I don't know. Is that your sense too?
So my sense is yes, that there is a general awareness that we didn't have in terms of what is healthful, but then there's this lack of care for themselves with that knowledge. So I still think there's like this discordance,
disconnect
where I think that as a society, we're more aware because there is more emphasis and education out there than I ever heard when I was younger, but it doesn't mean it's being applied.
Right.
And so part of that is the lack of learning and understanding how to create effective behavior change. And as lifestyle medicine physicians, that's something that we are taught and focused on a lot is, well, yes, I want to eat better. Yes, I want to move my body more. Yes, I want to be less stressed. Yes, I want to, sleep better and so on. I don't know how to do that. Right. And so I think we need to take a step back and teach how to create effective behavior change, which will lead to these changes, because you've got the busy resident. I coach residents, I coach medical students. I mean, they're working lots of hours of studying. They're exhausted. Their schedule's all over the place.
Right.
And so really teaching how to create the behavior change to meet the needs of what's going on in their life is important. I think that's a really important missing piece in education as well. Not only why we need to do these things, but how do we do them?
Yeah. And then practically speaking, like how do you do it in your circumstance, like as a resident or as a trainee? Because there are real like demands on their time, but then there are also probably strategies and ways in which that can be structured and that you could still meet your self-care. I don't know. When I was post-call, I would go home. I would stop at the cafeteria and pick up Cheetos and Gatorade usually. And then I would come home and like pass out on my sofa watching some mindless something. Nobody ever asked me like, what's your self, like, are you sleeping at night? They were just like, oh, you're documenting too many hours on the form. So
Yeah.
That's a really cool vision. And I don't even think that far off. Like, I really do believe this younger generation gets it more because they've seen a whole generation of their parents like burnt out. And I've heard from younger trainees, they're like, my dad was a doctor and I definitely don't want to be like as unhappy as he is. I've heard, and I'm like, that's what my daughter would probably say. No, she would have said in the past. So yeah, I want to sign up for your school.
Me too.
So your book is called Feeling Stressed is Optional.
Yeah.
But it doesn't feel that way for most people. Most people's stress doesn't feel optional. They feel like their circumstances are so overwhelming. So what do you say? What's the first step that someone can take? There are listeners who are saying, I don't think my stress is optional.
So stress isn't optional. We can't change the fact there are going to be circumstances.
That's right. The name of the book is Feeling Stressed is Optional.
Feeling stressed is optional, right? So that's the thing is that we can't necessarily control stressors from happening. And there are many categories of stressors. Number one is psychological, our thoughts, as you alluded to earlier. That's the number one stressor that we have. And the number one type of psychological stressor that we have is work-related, right? The thoughts that we have around work. But there are lots of stressors in life, right? We've got things that are happening outside of us with our families, with our friends, with our work, with the political environment around the world. There are things that happen abruptly, emergently to our family, our friends, our patients, our coworkers, and so on. There's our internal stresses, all the thoughts that we're having about everything. And so stress isn't optional. We can't, prevent that. Boy, that would be cool. If we could just prevent all those stressors from happening. But feeling how we feel about it that's the optional part. That is where you can change your entire nervous system and your thinking and your feelings and your emotions and ultimately the results that you want, really. And that's the magic.
I'm hearing is our stress itself isn't optional, but it's our response to it that is.
Yeah. And preventing it sometimes. So tools can work to relieve stress that's happening in your life in the moment. And you can put tools into place if you know that you're going into a stressful situation. Maybe there's a conversation you're about to have. Maybe going to meet certain family for certain events and things. We like to think of these always as being wonderful and joyous, but the truth is sometimes they can be stressful. Maybe, you're taking an exam or you're going in for your own medical appointment or whatever. And so there are tools that you can apply to help you feel calmer, more grounded, more clear, more in control in prevention as well as in the moment. And that helps to decrease and prevent all the symptoms that I had and even more. And then what else do we know? Well, the effects it has on your body messes up, tanks your immune system, right? So you get sick more often, causes you to have all types of chronic diseases. I mean, the most common chronic diseases in the world are directly caused by stress. Heart disease, diabetes, stroke, all that.
I think one of my takeaways from your book was that one of the biggest health detriments is coming from the buffering. And so I'd love for you to talk a little bit about that, about buffering and maybe how we interrupt that.
Yeah. So the buffering is a word that we use, which can be synonymous with escapes, right? And so when we have a feeling or an emotion that's icky, that we don't like, that we don't want to have, we can do one of four things. We can be reactive, meaning that you're going to say things or do things you wish you could take back. You can refuse it, like, I'm not going to feel that thing. I'm going to push it away. I'm just going to ignore it, which always comes back bigger and worse if you do that. You can buffer. And buffer is the escape. And the escape can look like many different things. It's something that you do to not feel the feeling or emotion you don't want to have. For some people, that looks like eating. It could be overeating or eating lots of sugary, fatty types of foods, French fries, cupcakes, ice cream, so on. It could look like over drinking, using alcohol to numb or recreational drugs. It could look like over shopping, buying like 5 colors of the shirt that you don't need, right? It can look like scrolling on social media for hours. It could look like things that seem innocuous, like, gardening. I had one client that would garden for umpteen hours. It could look like this one surgeon I have that was crocheting forever. I mean, it's anything that you're throwing yourself into, organizing your house, whatever, to not feel the feeling and the emotion that you don't want to have.
It sounds like there are healthy, and it makes sense, there are healthy and unhealthy ways to buffer, but buffering as a whole, is that something we should try to avoid doing versus, actually kind of diving into the emotion? Or it's like crocheting so bad, like
because anything can be too much of a good thing. Right. And so buffering isn't good, because buffering is you doing something to avoid, to push away, to not feel the feeling or emotion that is present. And the fourth thing, which is the healthy thing, is the allowing. And the allowing of the emotion and the feeling. And so that's actually, of all the 4 choices, that's the only one that's really healthy and safe. And so buffering isn't healthy. Now, if you want to crochet because you're crocheting, that's one thing. If you want to buy a shirt, if you want to have a glass of wine after your dinner because you're pairing with your food, if you are, choosing to have some birthday cake because you're celebrating, I mean, that's different. But if you are drinking the whole bottle, if you're eating the whole cake, if you are
because you're numbing
spending crazy
your
hours because you're numbing, and we know from research that the body keeps the score, and that those, and you even said like my back was hurting and all these things, well, because our stress causes symptoms in our body, and our body's talking to us when these symptoms are happening, and it's telling us, hey, hello, like, we got to crank it down. Right. And so if we refuse or push away, if we react, if we buffer, these things are really unhealthy for us.
And many physicians, many people, I think the pandemic shed light on the fact that how many of us were buffering with all the things you said. I think physicians, I was in your books, like, not completely surprised, but surprised at how high problem drinking is reported amongst physicians. And then knowing like, oh yeah, I do have friends who I know actually kind of drink a lot. And I used to myself like drink a lot, like in this buffering response. Like buffering really stuck out to me. You know what else stood out was how you describe, actually you go beyond the 6th, the pillar of lifestyle medicine, which is avoiding risky substances. And you say it's actually all of these things that we are using to avoid our allowance of these emotions.
Yeah. So my pillar, if I were to rewrite it, if anyone's listening out there from ACLM, but I call it escapes. I think it's really, because some people are not drinking and doing recreational drugs. So yes, we have the pillar of avoiding risky substances, but the thing is, a risky substance for some people could be, over crocheting, staying up reading trashy novels. Like I had one physician client till 3 a.m. It's anything you're doing to not feel the feeling and emotion that you're having that's only brewing and is going to come back worse. And really, we ask ourselves the question, well, and how successful have you been in, making it through your feelings and emotions to date? And the answer is 100%. You're still here, right? So they feel icky. I mean, nobody wants to feel disappointed, disrespected, angry, frustrated, sad, name it. Nobody wants to feel those things. And if you do, what happens? It's the allowing. And the allowing, recognizing, listening, and getting to the root cause of why you're feeling that way. That's where the life coaching based on cognitive behavioral therapy comes in. But when we just push that stuff away, it just makes us sicker and sicker, causes physical illness. causes emotional and psychological issues. And so the allowing.
And then I've become a big fan of letting go. And what I'm learning, I know is like you can't let go of something until you've allowed it to be. And many years would just resist feeling disappointed or resist feeling or feel those things, but then do all the things, either try to ignore it or buffer it. But never say, okay, I'm having this feeling. I'm very disappointed. Like, you're allowed to feel that way, and then you're allowed to say, I don't want to feel that way.
Yeah, you're allowed to feel that. You come home from work and you were drinking all that alcohol, but you stop and say, whoa, why am I reaching for this? What am I feeling right now?
No, for me, it was fast food. I would stop on the way home. I would stop at sometimes 2 drive-thrus. Because I thought I worked so hard. This is what I used to say. I worked so hard, I deserve this. But I was buffering. I mean, I was definitely buffering.
And what do we know now about how food creates mood, right? So those feelings that you have are driving the cravings for the sugars and the added fats and all that sugar and whatever and all the chemicals and so on. And then when we eat those things, it actually makes us feel worse.
Yeah, right.
Right.
And then there's a disconnect from that too. I wasn't even aware. I think so many of us aren't aware of how we feel afterwards.
We don't know that it's making us worse. If you're depressed and anxious and you're eating the fast food, you're going to feel more depressed and anxious, right? But we don't know that. No one teaches us this stuff.
It's fascinating. Sugar actually has an analgesic effect. A mild analgesic effect, but it's very short-lived. And then there's all these after effects that are much, that make you feel much worse. But I mean, obviously there's like some dopamine release too, but there's also some, like, I think I was having some pain relief in the moment. That is to say that I wasn't addressing the root cause of the pain.
That's so interesting. And when I was eating what I thought was I'm vegan, I'm eating, this healthy diet, and I was eating a lot of processed foods, which I didn't realize. I was really just making a lateral move, eating processed meats and processed cheeses and all these things. So actually I wasn't eating in a healthy way that I thought I was, which is only adding to my own, emotions and feelings that didn't serve me.
Physiologic stress. Like, I think on some level, like our diet, right? You basically write this, like it's adding, it can add to our stress, or it can actually help reduce our stress in a way. The food we eat.
Yes. So research shows it works another way as well. So when we're eating foods that are whole, fresh fruits, vegetables, nuts, legumes, seeds, grains, it actually allows us to feel calmer, more grounded, more clear, more focused. When we're eating this other stuff, it works the opposite.
And most people don't know that, and they'll think about that. I never used to think about what kind of mood is this going to put, or how's my energy and focus going to be after this double cheeseburger? That wasn't even on my mind because I knew I just wanted it.
Yeah, and again, that's that education piece. And so it's because you weren't taught otherwise. You didn't know. Maybe you knew that it probably wasn't the healthiest thing for you, but you didn't know that it was going to affect how you were feeling emotionally and psychologically, that your mood would be worsened. You didn't know that, right?
Yeah.
So that's fascinating. It's all chemical interactions that are happening in our body, even down to, what we put in our mouth.
So, Robyn, I'm just hoping you could maybe guide me and our listeners. If you're watching on YouTube, you can see this, but through like maybe an exercise, like a breath work exercise, or something a tool that we could use in the moment if we're feeling stressed.
Sure. Okay. We can weave a couple things together here. So let's weave together some breathing as well as some presence or mindfulness. And we'll see how it goes.
Okay. Love it.
If you are in a place where you are driving or operating some machinery or something right now, you can just listen in and then come back and practice along with us. And yeah, so if you're able, find a comfortable seat. And it could also be lying down. Maybe you're in a place where you can lie down. And if you're seated, take a moment to notice if the back of your body and your feet are supported, because sometimes we're choosing between one or the other, and maybe you can grab a pillow or something to put behind you or underneath your feet. And if you want to kick your socks and shoes off, you can do that as well. And if you're in a place that you're able, your eyes can be soft or closed. Either way is fine. And then notice your body breathing all by itself. This subtle lifting and lowering of your body with each breath that you take. Maybe you sense expansion and contraction of your body each time you breathe. If you're breathing through your nose, you can sense the cool air into your nostrils as you breathe in. The warm air leaving your nostrils as you breathe out. Feeling your clothing touching your body. Notice the parts of your body that are touching your clothing. And sense the air on your skin that's not covered. Sense the temperature of the air on your skin that's not covered. Notice any taste in your mouth from the last thing that you may have eaten or drank. Any smells that may be coming from your skin or your clothing, your hair, the air that's surrounding your face. Noticing any smells and sounds, right? So the sound of my voice, we may have just heard a dog, sounds outside the room, the space that you're in, being aware of all the sounds. Not pushing anything away, just noticing all the sounds. The sound of your breath, maybe you even hear yourself breathing. Inviting in all of the senses, whether your eyes are soft or closed, noticing anything you see that could be colors, shadows, lights, shapes, textures. All of your senses open and receiving. And as our senses are open and receiving, we'll practice what's called straw breath, which is breathing out through an imaginary straw, lengthening your exhale breath as you breathe slowly out through an imaginary straw. I'll describe it and then we'll practice it together, imagining first that you breathe in through your nose comfortably, and then you create this shape with your mouth as if you had a straw in it, and you breathe out at a rate that a candle would flicker on your birthday cake, but you don't blow it out. So let's do a few of those rounds together. Breathing in through your nose comfortably, and pursing your lips and very slowly breathing out. And whenever you run out of exhale breath, whenever that is, repeat breathing comfortably in through your nose. And when you're ready, pursing your lips and very slowly breathing out within your comfort. And continuing at your own pace, comfortably breathing in, pursing your lips when you're ready, and very slowly breathing out. Eyes are soft, face is soft, breath is easily coming in and out. Next round that you do, count how long it takes for you to breathe in and how long it takes for you to breathe out. Allowing that out or exhale breath to be longer than your inhale breath by whatever number feels okay for you. Just inviting length and exhale without force, just invitation of breath. And let's let this be your last round, ending with your exhale and just coming back to your natural breath, whatever that feels like for you. Sensing that lifting and lowering of your body with each breath, that expansion and contraction that happens each time you breathe in and out. All of your senses open and noticing how you're feeling. And if you found this helpful, invite yourself to put it in your toolbox and pull it out whenever you need it.
That felt amazing. Ready to be done.
I'm so happy to hear.
No, it's good. It's good. Totally out of my head. I loved the experience of, it seems like the pursed lip breathing is even more powerful in activating the vagus nerve. Yes?
Mm-hmm. Yeah. So what we know from our physiology is that when we inhale, our sympathetic nervous system is activated, which increases heart rate and blood pressure. And when we exhale, our parasympathetic nervous system is activated, which decreases heart rate and blood pressure. So our exhale breath is the key to our relaxation response. And so when we allow a longer exhale, working with our own physiology, we decrease our heart rate, decrease our blood pressure, and feel calmer.
Yeah, I felt it. What is your, are you familiar with like pranayama and like different breathing techniques, like alternate nostril breathing? And I've heard that recently, I know some stuff, but I'm not an expert or anything. But so I'm asking you, that breathing through, like occluding the right nostril and breathing through the left nostril is more activating of the parasympathetic system. Is that something you're familiar with?
So yes, and it depends on the person.
Okay. Talk about this.
Because for some people, breathing in traditional alternate nostril breathing, which is breathing in through left and out right, in right and out left, is calming. For others, it can be activating. Traditional yogic teaching is that breathing from left to right is calming, and breathing from right to left can be activating. So breathing in left out right, in left out right can be calming, breathing right left. So what I say to everyone is just to try it on for size and see if you'd like it. Because it's not one size fits all. So for some people, it can be calming versus activating. It just depends. And I've worked with thousands of people in the last 15 years or so, and that's why I invite you to have your own. Yes,
you've seen the variation.
Yes.
Yeah.
So I think that
that's fascinating. By the way, that's super fascinating. How different same breathing practice can have these differing effects in different people.
It also depends the speed in which you're doing it. So I teach over 20 different types of breathing tools, and and it depends also the speed in which you're doing it. So certain tools can be very calming if you do it very slowly, and other tools can be very activating when you're doing them more quickly. And so it's important to take that into consideration. So I just led you in something where I intentionally had you
do these very
slowly
exhales.
Yeah, slowly. And it can be hard to try and do that when you're stressed out. So being able to breathe out through a smaller hole than you breathed in, 2 nostrils, bigger, smaller straw, will naturally lengthen your exhale breath, will cause heart rate and blood pressure to go down. I've never had anybody have the opposite effect
from that
with that particular breathing tool, because it does work directly with physiology that we know, not with energy channels and things that we learn in yoga therapy, which that's my other hat. But as always, I have everyone try things on for size, see how it feels for you, take away what you want to remember, leave what you don't. It's okay. We're all wired a little bit differently.
Beautiful. That was a really wonderful practice, by the way. I'm sure I'll feel it for much of the day, the beautiful after effects of that. So thank you for doing that.
Thank you for inviting me to do that. And I try to share things that are very accessible so that you can do it on your own without having a guide. You learn with a guide at first, but then these are different tools that you can pull out whenever you need them.
Yeah, you have that in your book. Like there are various pages that are like tools that you can put in your toolbox. And you've said that during this conversation as well. And I really appreciate that because it gives so much agency to people to know that there are these effective techniques they can use. And they actually like, that's why I wanted you to share that. Because I think once people experience it, it's like a light bulb for many people, like you had basically in the yoga class. It's like a light bulb moment. They're like, whoa, I didn't know I had this control over how I can feel.
Yeah. Everyone's born with these innate superpowers. They just need to know how to use them.
Right. Okay, so Robyn, we ask everyone who comes on, we ask them this final question. So you're coming to our proverbial health feast, except it's a big group feast we're having. And everyone's bringing their life philosophy or mindset tip that they want to share with everyone. What is Robyn Tiger bringing to the health feast?
I am bringing to the health feast that the special occasion is now. Don't wait for the special occasion. That right now is the special occasion. Right this very moment.
Wow.
So go get it.
Oh, that's really cool. That's really cool. But the special occasion is now. Yeah, make the most of this moment. That's beautiful. Thank you, Robyn. And thank you. So if people want to learn more about you, if they want to work with you, if they want to learn more about your online courses, it sounds like you have some, or your book, where can they go? We'll put all that in our show notes, of course, as well.
Yeah, so the website has all the information. So StressFreeMD.net is the website. It has information about the online courses, my podcast called the StressFreeMD Podcast. It has...
Which I think I'm scheduled to come on soon, right?
I have asked... Yes, you are. I think you are scheduled.
I think I am
and
scheduled.
Yes, you need to listen in. Dr. Rock's coming to the StressFreeMD podcast, sharing his amazing journey and story with us.
I'm excited for that, yeah.
I'm excited too. The book, Feeling Stressed is Optional, is on there. I do coaching, one-on-one and group. I do retreats. I just got back from Africa with another lifestyle medicine physician who I think was also on your podcast.
Melissa
Dr. Melissa Sunderman.
She was just on our podcast, yeah.
So Melissa and I just get back from leading a retreat in Africa for healthcare professionals and their families and friends. We're going back in January.
Safari.
If that interests
How was
you.
that?
It was amazing. Wow. It was amazing. So not only were all the animals incredible, but getting to meet the communities, the culture, and educating in lifestyle medicine throughout, and then the transformations that have been unfolding since then.
Of people who went, that's really cool.
So good, yeah.
Oh, that's awesome.
So all that stuff is there.
Well, this is so cool. Yeah, it was really, really awesome, and I'm looking forward to speaking more when I come on your podcast. But For our listeners, we will see you back here next time. Please leave us a review and subscribe and share our episodes. And we will see you back here next time. Robyn, we do a fist bump to the camera. Yeah. Boom. All right. Thank you. Until next time, everyone, live well and rock on.